If it goes the wrong way, she may not get up. So we may think she's okay, right? But that's the she coughed. Yeah, so she may be actually aspirating. She may be aspirating and.
I mean, it was a brief cough.
So it was a, so it was a stroke.
I'm sorry.
It was a stroke.
I think so. Yeah. I mean,
So
I think we're gonna repeat
when
the scan.
did the stroke occur?
We probably think that when she started initially to have some trouble, she never been back to baseline, to normal after she went to, yeah, so probably she had a small stroke back then, but maybe it got bigger, it's always a possibility.
So
Okay. And
when is
are they going to give her the MRI still?
Yeah.
how soon can, if it's the first stroke, how soon can she recover to be normal as she was?
Yeah, I think, it depends how big the stroke is. If it's a small stroke, it may happen the same day. If it's a large stroke, it may never happen. And also it depends on where the stroke is. Sometimes
Just
a
give
big
her water.
stroke can cause less damage than a smaller stroke.
She's fine like that. Don't throw her.
No,
Yeah, so it depends on many things.
We have to stop
So-
because this makes it more
In other
likely that
words-
it goes down the wrong tube.
Will the damage, will she, what is the probability of actually she not getting any
Or just going to sit her up,
damage
move her
to the
up.
point where now we have
Yeah,
to
because we
deal
actually have
with
to get her in that.
her
That's good.
slow response to the point, or
Yeah,
she's
we're gonna put her
looking
back. I just
pretty
want to, while
much
she's
like
drinking, makes it less likely that it
in
goes down the
she's
wrong tube.
Clown 9.
Well, so the thing is, if she doesn't understand what you're saying, then she doesn't react to what you're saying. So it may
Well-
look like she's spacing out or being in a daze, but that she's actually awake, right? I mean, she
Well,
looks,
meaning, I mean, she's awake, but she's not responding
Yes.
as normal.
she's not responding because she doesn't understand. So if I talk to you,
No, she,
let's say I talk to you in Chinese, you wouldn't know what I was saying.
she understands. She understands, but her response is very hard for
I
her
understand.
to.
So sometimes, if depending on where the stroke is, it may just slow the response. So the response may be appropriate, but it's just slower than normal. Let's say, like in a highway, you have an accident, the cars still go through, right, to the
Give her
highway,
some more.
but at a much slower rate. Same thing happens with a stroke.
Well, when she gets back home, in other words, she's going to eventually get weaker and weaker. She doesn't listen to our nurse that she needs to exercise and walk. And she always had that lazy problem.
Okay.
So, is there any therapy that at least that, based on her age, she can be able to have some sort of a treatment on a regular basis that would at least slow down the process of actually getting old and getting weaker and weaker?
I see. So the stroke usually can get worse on the initial phase, but then most of the people get better. Okay, and there's physical therapy, which is asking the body to work and exercise, just like when you exercise, right? You get stronger, even if you don't have a stroke, right? But with a stroke, physical therapy is the most important to maintain the motion and to maintain mobility, make sure that she doesn't develop contractures or stiffness of the arms or the legs.
So, is it possible to have her have this type of treatment on a regular basis?
Yes. So we start the physical therapy while she's in a hospital. We start the evaluation, and then depending on how she's able to tolerate, she may go either to acute physical therapy, which means 3 hours a day, or subacute, which means lower intensity but over a longer period of time. So acute therapy means more intensive, shorter period of time. Subacute, less intensive, longer period of time. That depends on how she can tolerate that, right? Some patients may be able to exercise for 3 hours, some may not, depending on their strength, depending on how cooperative they are.
It's a given, but at least she would have some sort of a therapy
Yes.
on a regular basis. I myself, I have videos way back when I used to lift
Mike, make
150.
this short because they have to
100
continue with what they're doing.
150 pounds, and right now, I'm still going to the gym, but I would have to deal with only 50 pounds,
Right.
where I don't want to hurt myself,
Yeah.
and I have to accept that 50 pounds would be okay for me, where it's better than nothing.
Right, of course.
So, she hasn't had this, and I nobody in family ever questioned something that it would have been, she would have been better if she had at least 3 days a week, even 1 day a week. Would have been conducive to her aging process. So the part about feeding her, she had no, I mean, it's hard hurting that you have to see something like that. Where I still remember the times when I used to live with her. Chichi, please just do me a favor. Let me finish.
I know, but you
and
make the story
Chichi,
too long.
you don't determine how long. You're not a judge. And if you was, get back to school.
It doesn't matter.
Do me a favor,
That's
please.
okay.
Let's not argue because
Chichi, I understand that, but you have a point of actually dominating the time.
Okay. So you were saying?
If she can have this type of treatment, even if it's just once a week, it doesn't matter. But it's something is better than nothing.
Sure.
She.
So let me explain how it works. So one of our physical therapy specialists will come and evaluate her and see how much she can tolerate. If she can tolerate 3 hours a day, she'll get acute physical therapy. If she doesn't tolerate 3 hours a day, then less intensive is called subacute. So both are good. So it's better to tailor her therapy based on her ability to exercise, her cooperation, and so on. So the acute physical therapy usually lasts for a couple of weeks. Okay, the subacute may last longer. Okay. Now there's also some physical therapy at home that can be offered, but in general it depends on how her insurance is. I don't know if she has Medicare or what sort of insurance does she have.
Health
Yeah.
first.
At first, okay,
Medicare.
okay. So I think she should be
Medicare, I think
okay. In general, the progress, so the patients may still do better up to 6 months. After that, they kind of plateau. In other words, no matter how much exercise, they don't get stronger, right? But I think it's still important to maintain whatever they've achieved. And the recovery usually is about 75% of the possibility for recovery. It's not 100%.
So in other words, we would have to tolerate her condition now, the way she is now.
Well,
There's
not
no
right
choice.
now. Not right now. I mean, we'll see how well she'll do. So we just have to wait and
Meaning,
see.
what kind of damage was done?
Okay.
Where, this is my mom, and
Sure.
I used to debate with her. I mean, I remember the times that I used to goof around and take her cane, because and goof up and make a joke about as his mom. The only time, with the doctors and
Sure.
give her a cane. I says, Mom, you don't need a cane, but you really need to carry a cane. It should be some sort of a weapon, rather than think that they're going to get you to that point where you're going to be crippled, as far as having a cane to rely on the condition that is coming ahead, to the point where you're getting older. So it's not something that I'm very comfortable about.
So usually strokes do get better over time. So initially you might get a bit worse, like what happened, and then usually they get better over time. So we expect it to get better over time, but we can't guarantee that.
You can't guarantee.
Yeah, but
So,
we do expect it to
well,
get better.
what would the MRI,
It would prove that she had a stroke and it would show us where the stroke was.
and it would
how
show
big
the
it was.
conditions of actually what is the damage now?
It can show the damage, but it does not predict how well she'll do. That depends on her ability to cooperate with the physical therapy. Let's say if you ask her to do an exercise and she doesn't understand what you ask her to do, then she won't be able to do that, right? So that's one of the limitations of a stroke. Because patients, or in general, people, do whatever they're told to do if they understand, right? If they don't, then it's a problem.
I mean, it's never a problem, because depends on your on the treatment. where based on the individuals, some people are slower than others,
Sure,
and some
yeah.
people can. But nevertheless, there's still something that actually can be done. You
So
have
when
to.
a stroke happens, the damage to the brain is permanent. What we do is we try to improve functional outcomes
Well, yeah,
and prevent more strokes.
you know, it's like you have to deal with certain people with
Sure.
their ability to actually do better than others. That's just the way of life.
Yeah. The brain recovers on its own. We just try to help it.
But
get better.
there's still a hope as far
Of
as
course.
to actually not give up on it. But you know, it's just you know, some people just stay fat and worry about their weight and not care about their weight. Some people would do something like, oh, let me fast for a day or fast for a couple of hours. Some people just feel like, oh, you know, they just don't do anything for themselves.
Moving forward, it's very important to make sure your blood pressure is well controlled, sugars are well controlled, cholesterol is well controlled. So these are going to be the goals that we make sure we focus on, so it doesn't get any more strokes. And the stroke that's already happened, the brain usually recovers on its own to a degree, but it takes some time.
Right, as I say, about 6 months.
6 months
Yeah, but the physical therapy may not last for that long, right?
may not last that long,
In other words, she may be sent home or to
but no,
not like not after 6 months. So after a couple
Meaning,
of weeks or a
it
few
can be.
weeks.
I mean, it's something that if her insurance will cover it.
Right, exactly.
It can be until the day she dies.
Well, so then she needs to have recurrent approvals for the physical therapy. That's what it is. So the primary care doctor will, write a letter to recommend further physical therapy, and that's what she'll do.
So we have to pay for it.
Well, she already paid, right? She has insurance, right? So that's what insurance.
I mean, is it? I mean, based on the insurance that she has, is it possible?
Yeah.
Yeah.
Well, I don't know what the terms of the insurance are, because we're not really specialized in that. But Medicaid should be okay, except that you have to speak with a social worker and see what the insurance can provide for her.
Usually insurance covers.
So the MRI would determine the damage that's already occurred
Yeah.
and whether it's reversible.
Well, no, the damage is not reversible,
No, I mean
but it's like
whether or not.
no.
So damage
So let me
is
explain.
Huh?
So let me give you an example. In a team of 10 players, like let's say football players, in a team of 10 players, if 2 players get sick, then the other 8 have to work harder and run faster.
Right.
So they
Or
can,
replace them, like always.
but they can't, because the problem is the brain is not replaceable.
Meaning,
So what-
we're talking about team. Team, you know.
Yeah.
I mean, once somebody is not giving
Right.
their 200%, you know,
But the analogy
they can
is,
go home and play with their kids, right?
right. But the analogy is we don't have extra players.
Excuse me.
The analogy is that we do not have extra players,
Is
so we
that-
have to deal with those 8 players.
Is that your opinion?
No, that's a fact.
I mean,
you
there's.
can't replace the tissue that's already been damaged.
Oh, you're talking about the
brain.
the damage.
Right.
Well, that's my what I need to know. It's I mean I would know better because I know her condition of how she's responding now and how she responded before.
More.
It's like having a dog that you train him and then the dog is not responding what you have been taught. I mean, dogs are very based on human beings. Some dogs can do better than human beings.
Sure.
And which is like they become police dogs and military dogs, and they don't destroy them like until when they're retired. They just hope that somebody will take care of them
Sure.
and give them the therapy that they need
Absolutely.
for the rest of their lives because they earned it,
Yes.
right?
I agree.
So it's I appreciate you doing your best and getting her back home. I'm not impressed with a fancy room, or actually, doctors are scratching their heads and trying to figure out what's the next move. And we're just a phone call away. I'd rather see her at home where I can FaceTime. She has a home attendant. She has family members. She has cameras all over the place to determine her,
Sure.
it,
Safety.
safety.
Yeah, let's see what physical therapy say first.
Well,
and
how long is it going to take? I
if they
mean,
recommend going to acute rehab, I think that will be.
in other words, the MRI.
I'm coming back. One
How long?
second.
What time?
So we don't control the scheduling. We hope it's going to happen as soon as possible, but I can't give you an exact time because we don't control the who goes and who doesn't go.
Yeah.
But
But
it's still happen
that-
as soon as possible.
Yeah, the MRI is not as urgent as I would say repeated CAT scan. But the MRI will happen, okay? But I think the physical therapy may come to see her today, or they may come. I'm saying they were here already. So we'll see what the recommendation is, and based on that, we'll go for it. Okay. But she'll be here for a few days, at least over the
A
weekend.
few days?
Yeah.
Just,
Yeah.
because I think my opinion is that if she gets back home, it would be more of her wanting to get back to a regular schedule of normal behavior, which means that she will have an incentive to get up and at least sit down.
Yeah, but remember how we said that physical therapy is the most important thing after
Well,
the stroke? So
meaning that's not it's still on the table on a regular basis for at least three, even if it's three times a week and she doesn't respond, at least it's being worked on a regular basis because the insurance is paying for it. Who cares if she's not responding as she should? But the part is that she's in the process of actually getting stronger and stronger and stronger, and that's the best that we can do. No therapy and being at home and not wanting to walk as she should or exercise at that. It would be, I think, again, going back home while you guys scratching what's the next move. It's something that I don't feel that her health and actually having a blood thinner because she's in bed. I don't believe in more drugs, whether it's illegal, to actually. The less drugs that your body will take, the better it is, even if it's a pill or
but sometimes you need the medications, right?
you know what?
What can happen when the blood pressure is too high? You need to control the blood pressure.
I believe I focus on alternative to health based on medication. It's just my opinion, and it's always been a struggle between medication and being a pharmaceutical specimen. And it's just something that, I with no respect as far as, it's not your disrespect, it's the pharmaceutical that want to push their illegal drugs. I don't believe in that. I believe in the fruits and vegetables and the proper meal.
That's something to discuss, of course, later on with the primary care doctor also.
But yeah, sometimes you need medications.
Meaning,
Okay, that's something to consider.
meaning you understand sometimes you need medication. If I go to the gym and I'm feeling pain, and I have a choice of actually getting some, Advils, I will not get Advils, even if there's a choice, because the progress of actually going home and stretching and making sure, I think the stretch will be better than, like let's say you have a little back pain. Everyone winds up with their medicine cabinet, not knowing that a simple stretch would actually be conducive to their health. So they rely on medication, as you can, as you preach about. It's not something that I'm comfortable with.
Okay. All right, very good. So let's get the MRI and
Repeat last time.
yeah. we
And
can
what do you think
discuss.
of the swallowing? She was able to swallow half the small cup, but it took a long time.
Okay, so we'll need to get a calorie count, see how much food she can tolerate.
She's been tolerating the food very well. I mean, what the broth.
Yeah,
Just the
my
broth.
question is because she's swallowing slower than normal, and the question is, can she eat the full meal or just half of it?
Oh, I see.
Okay.
Should we get an NGT?
Okay. No, not
Yeah,
for
because
now.
I brought in like the small, like a small soup. So I just gave it a broth for about that much, and she had all of it.
Okay. All right.
So
Very good. Do you have any other questions for us?
No, but
Okay, thank you very much. for
appreciate
coming.
the time.
Thank you.
Sure.
Thank you.